Leadership. Today we're talking about leadership. So what is leadership? Leadership is something we carry out daily without even knowing it. Our leadership behaviours are adopted from the way in which we manage ourselves. It's our own personal qualities, beliefs and opinions that influence others. To be a competent leader, one must have a level of self-awareness. To be confident, to be resilient, to be able to reflect, have some form of self-control and be determined to succeed. How we behave and interact with others enables us to achieve our goals and outcomes. To lead, we must be able to motivate people in a way which is inspiring to others. Democratic and participative leaders tend to make the final decisions. However, teams are encouraged to get involved, allowing everyone the opportunity to share their ideas in planning and developing goals. Teams are more productive and acquire more job satisfaction due to their involvement. Evidence supports those nurses who engage in participative leadership are more likely to carry out team operations and their individual responsibilities. If employees prefer not to be involved, then this leadership will not be as effective. Progress may be slow in arriving as decisions and various options are taken into consideration. According to the Royal College of Nursing, participative managers who are facilitative and show emotional intelligence are the preferred style of management in nursing. Good leadership plays a part in teams working together. It reduces stress, high empowerment and self-efficacy. If there is effective leadership in place, then it is more likely that excellent quality care is delivered. Genuine leaders make better role models who are consistent with values and share their healthcare vision. Staff are more motivated individuals who are stimulated by creativity and innovation. Transformational leadership is viewed as the gold standard in nursing as it aims to improve patient outcomes and better job satisfaction. These types of leaders encourage positive change and are the most effective for increasing patient satisfaction. Mental health nurses are required to strive for clinical excellence, having the confidence to motivate and challenge others, working respectfully in a way that is effective. Positive leaders build a collaborative and supportive environment along with staff satisfaction. I identified that one of my developmental goals was to improve my communication skills for conversations to be effective, which would enable me to support and manage those with chronic disorders, to unite person-centred care with up-to-date communication skills. This is essential when delivering decent quality care which is carried out safely within the healthcare environment. Having self-awareness in recognising my sensitivity towards the concerns of others can lead to different perspectives being shared. During my practice, there was a time when I was able to support the doctor when trying to calm a patient who was displaying signs of emotional distress. I identified the doctor's weakness in his approach to alleviating the situation, as I could see that he was expressing signs of irritation conveyed through his body language, which was not helping the situation at all. Although non-verbal cues are seen to be less of importance, evidence proposes that this kind of communication can influence the patient's level of satisfaction. I, however, cared for my team members, and for me to demonstrate how I lead with care, I wanted to try and resolve the problem. By communicating openly, I was able to take control of the situation by offering an alternative view for the patient, which resulted in a more positive outcome. To have a thorough impact on employees is a means to change their understanding and behaviour pattern, is how transformational leadership is achieved. As we already know, leadership is one of the most significant elements in the development of health and safety culture. It is required for the movement for motivated members within an organisation or utilising resources aimed at accomplishing the mission. The theory behind transformational leadership recognises charisma to be a necessary aspect for leaders to have the capabilities of influencing the attitudes and behaviours of others. As a leader, I need to be competent, as this is vital for sharpening evidence-based practice in safety and quality care health settings, specifically within the framework of nursing leadership practice. Research supports and illustrates the importance of one's abilities to motivate and enhance communication, which is to apply science to daily practice, having control over experience and individual obligation, resources and health organisation that qualifies the methods for the achievements of risk management. Finally, let us talk about delegation. Delegation is a method where tasks are given from one person to another. For example, me as a student nurse giving out various care tasks to a group of people, such as healthcare assistants. And to do this in a way which works, whilst creating a positive outcome for job satisfaction, successful teamwork and production. The Royal College of Nursing states that nurses have a duty of care and legal responsibility to the patient, and when delegating tasks, these must be delegated in a way that is appropriate. During my experience in practice through handover one morning, it was apparent at the start of shift that there was a clear shortage of staff. It was vital to acquire more staff as the amount of 2-to-1 clinical observation that were on the ward meant that there were not going to be an adequate number of staff to care for the patients. I took it upon myself to raise concerns to the clinical lead to report that more staff were needed to keep the patients and the staff safe in the ward. With the remaining staff, however, I prioritised the tasks according to the patient's risk and level of the observations. Assigning healthcare assistance to those who were deemed to be more at risk first, then working back to those who required the lowest level of intermittent observation. To develop my skills further when delegating care successfully, I would avoid continuing to leave the same number of staff on one-to-one observations for too long, as this is too repetitive and the individual may have certain skills which could be made better use of elsewhere. Not delegating care appropriately could mean missing important tasks and poorer job satisfaction, which could lead to the patient not being provided care that is best for their best interests. The Nursing and Midwifery Council, NMC Co, declares that to practice effectively, nurses must be accountable for their decisions made when delegating tasks to others. To attain this, tasks must only be delegated according to an individual's level of competence, ensuring they fully understand what is required to perform their task safely. An individual should be supported and supervised when providing safe and compassionate care, and by validating results of tasks delegated ensures that required standards are being met. The Royal College of Nursing also states clear communication is a key skill when it comes to delegating effectively. For me to develop my own capabilities, I need to be able to clearly communicate and delegate competently while taking control of the working environment. It is extremely important to understand the strengths and developmental needs of the individuals of my team. I need to be inspiring to get things done, to develop my trust in my leadership skills and display trust in others, remembering to always apply the core values of nursing: care, compassion, competence, communication, courage and commitment. In conclusion, leadership is crucial with every care setting, which commands collaborative efforts of many individuals. Nursing leaders are imperative to healthcare organisations, and leadership ensures those leaders are committed to providing safe, reliable, quality care and by bringing positive change to the nursing profession. Having a level of self-awareness is bottom line for good leadership, as it allows leaders to pick roles in where they will succeed, along with identifying how to develop teams which will integrate their strengths. Being aware of my working style and how it impacts on employees may enable me to take on a better leadership style.